glad that Barnabas is here. My mother's currently without work, and I'm working some extra hours, but even then having to cover for a whole other adult, it has become a rather tight situation.
It was very nice for they sharing Barnabas with us, and thank you for all of the people.
Sharing is caring.
Yes, it very is.
So we're here to help people in a normal crisis, a personal crisis, natural disasters like a hurricane. But when the pandemic hit, we had never seen anything like this before. Within a matter of days, businesses were shuttering. Thousands of people in this county lost their jobs without any warning. The first thing we had to do, we kind of took our walls down so that we went out into the community. We converted our mobile health van into a mobile food pantry, and we took food out into the poorest areas of our county. The food supply became an incredibly significant challenge for us. So we developed partnerships with a farmers co-op in Hastings, and once a week we went to this farm co-op and picked up thousands of pounds of fresh produce. So we were doing mobile food distributions 4 or 5 times a week. We also changed the way we provided financial assistance. So we went from an average of 500 people a month to being served to 500 people a week.
We're grateful for our partnership with Barnabas. It enables us to distribute food to our community. There's a lot of low-income households that live here, and so it's definitely a need. And we don't actually have the capacity ourselves to do this type of ministry, so we were really excited to partner with Barnabas.
I thank them out of the bottom of my heart because the Barnabas is trying their best to help Nassau County.
The Barnabas is great. I don't know where I'd be without them because I ain't got no insurance, and they helped me out a lot. Yeah, I don't know where I'd be.
We're the only healthcare provider for people who have no health insurance in this county. So we created, in a very short period of time, a virtual way for us to treat our patients.
Telehealth has been really great for our patients because give us access to people that may not want to come into the office because of the COVID epidemic or cannot physically come into the office because of that.
To me, they are a godsend because I wouldn't be able to afford health care because I am on a fixed income. And when I was trying to have health care, it was more than my check. I couldn't afford that, so I had to let it go. So having Barnabas Center available to me is really an answered prayer. I really appreciate them. I consider them friends.
The other thing is we're the only dental care provider for people who have no health insurance. People still had urgent dental needs, like an abscessed tooth. So we have a volunteer dentist, Dr. Owens, who stayed and volunteered 1 or 2 days a week to see those urgent dental patients. If it wasn't for him, I don't know what we would have done for those patients who were in critical need.
My wife and I have lived here since 1971, so 49 years we've lived here. Barnabas has made a huge impact on the community. It's a very good bunch of people and doing some good work.
So we take stewardship very seriously. We want to make sure that every dollar that is entrusted to us is used for the purpose for which it is given, and that the majority of those dollars go directly to help people in our community.